Senior citizens are particularly at risk from the coronavirus. That means getting out is particularly complicated. The federal government has allocated $9 million for vulnerable seniors. I'm joined by Kim Hockey, Director of Community Initiatives for the United Way. So, Kim, how much money did our community get?
Yes, $9 million sounds like an awful lot of money, but keeping in mind that it is spread across Canada, our community, and it's based on population size, we received $65,000 for Kingston, Frontenac, Lennox, and Addington area.
But that's nothing to sneeze at. That can go a long way on top of the services that you're already offering.
Absolutely, it can go a long way, and it is going a long way.
And how are you using it?
So, one of the things that we did right off the bat, we brought together, we have a committee, United Way Retiree Committee, and we brought individuals together from that committee along with a couple of organizations, the Seniors Association, Council on Aging, to talk about how we could invest these funds. And sort of all at the same time, while we were reacting and responding, knowing that we were having this money come to our community, of course, our community heard about it, and we started to get phone calls from seniors in the community. And right off the bat, the thing that was identified from themselves was a need for food security. So whether that was, finding out what grocery stores were offering delivery or curbside pickup, or whether that was the fact that they were isolated and not able to get out, and also struggling with a means to even be able to purchase food. So initially it was food security, and then also that issue of isolation.
What about picking up mail if they don't have door delivery? What about medication? What about doctor's appointments?
Yeah, that's absolutely a need as well. We certainly have heard and we have seen that there is a need for assistance, like you said, with picking up prescriptions or helping individuals get to their appointments. And there's different programs and services, agencies in the community that do offer those types of services. So quite often, maybe a senior is already associated with a group like that.
And that would take care of that, which is really
Yeah,
great.
it
Yeah,
is really great. Yeah.
yeah.
And if that need is identified, of course, that hasn't been something that's come to us specifically as far as agencies needing help and assistance to provide those types of services, but it certainly is something that would be eligible for funding. Mm-hmm.
Yeah, and food, I know that really is the first thing we go to. That was after toilet paper, right? Um,
Right. Yeah.
right, yeah. I the other thing is you've got to be computer savvy to do pickup or delivery. I think you can pick up the phone and call them and place your order, but
Yeah.
even to do your grocery shopping,
Yeah.
there's yeah, there's varieties and things and specifically and what size and all the rest. So I know I'm using one of those types of services. It takes hours
Mm-hmm.
it was a lot faster just to go to a grocery store, but times have changed. I get it. Yeah, I see it. So if you're talking to vulnerable seniors, what are some of the things when it comes especially to isolation, loneliness, and so on? What are some of the things that you could recommend to them and
Well,
say, yeah,
that's exactly what we're hearing and what we're seeing from the agencies, and how the funds that we've received through the federal government are being invested. So check-in calls, for example. There are a number of seniors that are just they're isolated, and they are looking for support, like you said, with maybe how to get online or how to make that phone call in order to get their groceries, or they do need some assistance having groceries brought to their door. So some of the programs and initiatives that have been funded are things like, like along the lines of food, for example, Victorian Order of Nurses in the Greater Kingston and Napanee area. Well, they are already operating like a Meals on Wheels type program, but there are a higher number of seniors who are finding themselves in need. And so they're doing those outreach calls, and they're receiving calls from not only seniors but family and friends. And through some additional funding, they're able to expand their delivery program and expand the number of meals in order to make that outreach possible, especially again with the Rural Frontenac Community Services Organization. So the Central Northern Frontenac community areas, where the communities do a really great job. They know who the individuals are in the community, so they're making those calls. And with a little bit of extra funding, being able to add an extra day of delivery and an extra few meals, hot meals, frozen meals, to be able to get them to individuals, particularly in those more remote communities, but also within the villages, because seniors don't necessarily have transportation, and also they're one of our vulnerable population. We've told them, you need to stay in, you're at risk. So we want to do absolutely everything we can in order to support the agencies, to work with them to keep them safe in their homes.
And I got to think the VON, with their medical training, if a senior says, oh, no, I'm fine, I'm doing great, they could look at them and say, I'm not so sure. I think maybe your meds need adjusting, or I think you need more than, not every, you don't always know that you're not doing so well, you know?
That's right. And I mean, from the health perspective, but also from that aspect of loneliness and isolation. Um, we've heard many stories of seniors who are just grateful to have had the phone ring and an opportunity to have that conversation, that somebody is caring about them, somebody is checking in on them. Oh, and by the way, we can help you, if there's something that you need. Another great program that's been funded is we're working with Kingston Community Health Centers on the Seniors Food Box program. Hopefully folks in the community have heard about that as well. And that's a free box of fresh produce and staple items that they can have delivered for free every 2 weeks. So we've been receiving numerous phone calls. It's just in its first week of delivery, and there were 80 households that received groceries, and the numbers are climbing. So that's been made possible through this fund as well.
Well, good food nourishes the soul as well as the body. And during this time, that's so important. It's important to all of us, and to someone who is isolated. It's big. It's bigger than it was before.
Yes, absolutely, absolutely. And then we have also, so talking about isolation, we are also helping to invest in making sure that seniors are having those check-in phone calls. So with the Seniors Association, for example, and also virtual programming. So programming with physical activity, or whatever kind of, I don't know, maybe art or what have you, just for that sense of engagement as well, and to be able to connect with other seniors, in addition to the phone calls that staff and volunteers are making, like 300 and upwards on a weekly basis. Independent Living Center Kingston, they support seniors with disabilities, and there's been quite an increase in needs for support for that particular population of seniors. They're already in a situation where they probably and most likely need some help to navigate systems that are up and running on a regular basis. But having this extra level of complication with COVID-19 added into the mix, again, so being able to provide some additional support for some additional staffing, make those calls to help those seniors get connected with the other programs and supports that they need in the community. Mm-hmm.
Now, if someone out there, and a lot of us have time on our hands these days, but would they use more volunteers to just to be able to pick up the phone and once a day call and check in on somebody and say, how's your day going? And someone who just likes to talk on the phone, would that be something they would be interested in? And if so, how do they make that happen?
So we're taking calls from volunteers in the community who want to offer their support, and anywhere that we can match them to programs and services that are able to use volunteers, we're doing that. And another program that we've actually been able to fund with the federal dollars is resolve counseling. So we were talking about, isolation and just the heightened mental health and well-being of seniors, the added stress that this is adding. So we've been able to support some additional counseling services to make sure that those seniors are, again, being kept in touch with and have an opportunity for, 4 or 5 sessions over a period of a few months.
Well, it sure sounds like you were stretching that $65,000 to the
Yeah.
absolute limits, and good for you. It's all very well thought through, and it's terrific. So, if anybody out there, a vulnerable senior who's watching this, wants to get in touch with you, what's the best way of doing that, Kim?
Sure. Well, as you mentioned, phone call is probably easiest. So the phone number here at United Way is 613-542-2674. And our website is www.unitedwaykfla.ca. And there are numerous resources there as well that can be downloaded or just looked at on the screen.
Thanks for being with us today, Kim, and stay safe.
Thanks so much, Donna.